Let's dive into the world of general anesthesia, an integral component of contemporary medicine that has turned the excruciating ordeal of surgeries into a painless experience. Cast your minds back to the initial years of surgery when the term anesthesia was non-existent. In those times, surgeries had to be performed devoid of any form of pain relief, subjecting patients to an unimaginable amount of suffering. The lack of anesthesia not only made the surgical experience horrifically painful, but also resulted in sky-high mortality rates. Additionally, it curtailed the types of surgeries that could be undertaken, confining the medical field to a narrow range of procedures. The introduction and subsequent development of general anesthesia was a watershed moment in the realm of surgery. Its invention not only took away the torturous pain related to surgeries, but also broadened the spectrum of possible surgical operations. Isn't it awe-inspiring to witness the leaps we've made in this journey? From a time when surgery was synonymous with unbearable pain, we've progressed to an era where individuals can endure complex surgeries without experiencing even a twinge of pain. Nevertheless, it's essential to keep in mind that anesthesia, though a boon, has its own set of risks and side effects such as potential allergic reactions, post-surgery confusion, and rare cases of anesthesia awareness. Reflecting on our strides from the rudimentary years of surgery to the present day, it's intriguing to see the distance we've covered. The contribution of general anesthesia in this advancement is indisputable. It has not only reshaped the landscape of surgical procedures, but also emphasized the need for open dialogues regarding anesthesia-related issues with healthcare professionals. This facilitates patients in making informed decisions. So, the arrival of anesthesia the discovery of ether marked a unique chapter in the annals of history. Originally, it was used as a recreational drug, offering users a euphoric, dreamlike state. However, the real potential of ether was recognized not in a hazy drug den, but within the hallowed halls of a hospital. This crucial turning came in 1846, thanks to a visionary dentist named William T.G. Morton. At Massachusetts General Hospital, he conducted a public demonstration where he successfully utilized ether as an anesthetic during a surgical procedure. This groundbreaking application of ether wasn't just about making surgeries painless. It was a watershed moment that transformed the world of medicine forever, underscoring the significance and magnitude of Morton's discovery. However, ether was far from perfect. Its high flammability represented a significant risk, and its pungent, sickening odor meant it was not a popular choice. These issues necessitated the search for safer, more user-friendly alternatives. This quest led to the uncovering of chloroform. Chloroform first saw use as an anesthetic at the hands of Sir James Young Simpson, a renowned Scottish obstetrician, back in the year 1847. Chloroform proved to be more potent and had a quicker effect than ether, but it came with its own set of risks. It was later discovered that chloroform could inflict damage to the liver and lungs, leading to its decreased usage. During the course of the 20th century, the field of anesthesia went through a significant transformation with the development of safer and more potent forms of anesthetics. Amongst these, nitrous oxide, more widely recognized as laughing gas, was a major breakthrough. Additionally, intravenous anesthetics, notably sodium thiopental, emerged as a go-to solution in surgical procedures. As we delve into the contemporary era, the domain of anesthesia has evolved into an intricate science. A broad spectrum of anesthetic drugs is now at the disposal of medical professionals. These drugs are meticulously used to ensure that patients remain oblivious to pain and stay unconscious throughout the surgical process. The advent of general anesthesia has revolutionized the field of medicine by enabling the execution of intricate surgical procedures. This game-changing innovation has played an instrumental role in preserving innumerable lives that might otherwise have been lost. It's worth reflecting on the colossal impact general anesthesia has had on the medical world. In its absence, the landscape of medicine would be radically different, quite possibly less advanced and undeniably more challenging. Discussing the potential risks and side effects of general anesthesia, it's crucial to be aware that safety is usually ensured. However, there could be potential issues that could arise. These include minor complications such as feelings of nausea and incidents of vomiting, escalating to more severe problems like experiencing allergic reactions or having difficulties with breathing. While general anesthesia has revolutionized surgery, it's not without its complications. The potential complications can vary, from allergic reactions to breathing difficulties and even post-operative cognitive dysfunction. These complications, although serious, are relatively rare. Anesthesiologists are extensively trained to manage these situations and have the expertise to respond effectively to any unexpected developments. It's important to remember that the benefits of anesthesia usually far outweigh the risks. These medical professionals work tirelessly to ensure your safety and comfort during the procedure. Awareness of these risks is crucial, but it's also vital to remember that anesthesia is a key component of safe and effective surgery. Scene 8. Talking to your healthcare provider. If you're about to undergo surgery and have any apprehensions about the use of anesthesia, it's highly recommended to open up a dialogue with your healthcare provider. They are well equipped to provide you with detailed information about the procedure, the potential risks, and the likely outcomes. Remember, knowledge is power. The more informed you are about the upcoming, the less anxious you'll feel. So don't hesitate. Express your worries and allow your healthcare provider to navigate you through it. Scene 9. The journey of general anesthesia. Reflecting on the voyage of general anesthesia, we unfold its history from initial discovery to its game-changing influence on surgical processes. This captivating expedition is a display of progressive innovations and refinements in methods that have radically transformed the medical arena. Additionally, it underscores the unyielding dedication and ceaseless endeavors to improve the safety and potency of anesthesia, bolstering the unending quest for a painless surgical experience. Scene 10. Appreciating the science of anesthesia. As you're about to put on a hospital gown, poised at the threshold of surgery, inhale deeply and allow yourself to marvel at the awe-inspiring scientific developments that have rendered your procedure virtually painless. Contemplate the fascinating journey of evolution and the numerous minds that have enriched it. Recognize the ceaseless endeavors of trailblazers like William T.G. Morton, whose input has been fundamental in molding the terrain of contemporary medicine. And during that moment of reflection, let a wave of gratitude envelop you. A gratitude for the unyielding quest for understanding that made the impossible possible. A gratitude for those who dared to envision, dared to investigate, dared to revolutionize, and in doing so, have improved our lives significantly. Don't forget to express this gratitude, for it is these individuals who have enabled you to stand here today on the verge of a fresh start, free from pain.